We're here at Hialeah Hospital with the CEO, Michael Bell. Michael, how are you?
I'm doing great. How are you doing today, Nestor?
Fantastic. Michael, we appreciate you inviting us here to Hialeah Hospital, learn more about what's going on here at Hialeah Hospital, all the different things that Hialeah offers to the community.
Sure.
Truly a community hospital. Tell us a little bit about what's going on at Hialeah Hospital.
Well, first of all, thank you very much for taking the time. It's been our privilege. We've had a wonderful time walking around the facility and kind of reintroducing you to Hialeah Hospital.
Yep.
Almost had a chance to introduce you to somebody that may have been working when you were born here at Hialeah Hospital. But the most important thing that's going on at Hialeah Hospital is the same thing that's been going on since the very foundation, which is a community of people taking care of our community, the Hialeah community. We are the community hospital for many, many people here. I've been in Hialeah for about 6 months. Everywhere I go, somebody says, "Oh, I was born there. My kids were born there." That place has an important part. On the other end of life, somebody says, "Oh, my grandmother passed there," and so we are a part of people's families. We're privileged to be there at the beginning of so many lives, the family starting, and as things occur throughout somebody's life journey, we tend to also be there. So I think what's going on here at Hialeah Hospital is what has always been going on, is people taking care of people and meeting the needs of our community.
Fantastic. Now, obviously, a lot's changed in the hospital since it first opened in 1951, right?
Yeah, 1951, 52.
And Hialeah has grown to be the second biggest city in the county, one of the largest industrial cities in the state of Florida.
Yeah.
The demands here within Hialeah are unique and abundant. Let's put it that way. As with all the different hospitals, tell us a little bit about what makes Hialeah different than all the different hospitals, and how you guys service the community.
Yeah. So what makes us unique is we are the community hospital for Hialeah within this area. I look at a 3 to 5 mile radius of just without that. Hialeah Hospital has ridden along with the community of Hialeah, the economic up and down, and I think it's back on and up. We've taken care of that population as it's changing. Early on in the 50s, 60s, 70s, into the 80s, there was a lot of births. We were one of the top labor and delivery hospitals in the community. Like I said, many families got their start here at Hialeah Hospital, and many people point back to Hialeah as a place where they began their life and living here in the Miami area. Now, as the population continues to age, we've implemented specific programs to take care of the elderly population. And it really is our privilege to reflect that community. So anybody who grew up very comfortably within Hialeah, being able to speak both Spanish and English, and having people that understand them, come from this community, speak the language, offer the food, make them feel that same appreciation that they would have at home, I think is a real distinctive. We are a local community, local hospital that really reflects the community. At the same time, what I think is unique about Hialeah Hospital in particular is our relationships with sister facilities such as Palmetto and North Shore, who have some higher acuity or higher services such as cardiovascular care and some advanced stroke care that we can tap into. And so patients that come here for emergency treatment, they get rapidly assessed. If it's safe and appropriate for them to stay within the community of this site of Hialeah for their care, then we'll keep them there and tap into the resources of the experts at our sister facilities. However, if they need the care at Palmetto or North Shore, then we can very quickly transfer them for that thrombectomy care, which is one of the most advanced comprehensive ways of receiving stroke care at Palmetto, and then come back home here to Hialeah Hospital, where they can be close to their family, close to their friends as they recover. So I think that's one of the distinctives, is when you look at Hialeah Hospital, you're not just seeing Hialeah Hospital, you're seeing the whole network of hospitals and physicians and experts that can provide care to this community.
Now, well, it serves Hialeah very well. It also has been serving Miami Springs very well for many years, for decades. So it's definitely a part of kind of, if you will, a heart of the community where life begins, right here at Hialeah Hospital. Now, tell us, obviously, I was privileged to be part of the baby boom back in the 70s here at Hialeah Hospital. Tell us what's going on today, in terms of babies. It sounds like it's still a big thing that Hialeah Hospital does.
That's right. So Hialeah Hospital still has privilege to bring into this world about 1,200 births, babies every year.
Wow.
People choose us because of the physicians that we have, our OBs, have been working in this community for a long time. Dr. Bali, Dr. Castellon, we have some new physicians like Dr. Khan who are joining the community and bringing some new understandings of OB care. At the same time, we have our NICU, so that for some of our preemies, they can continue to receive care. And for the families that are here in Hialeah, that's such a convenience because, as you know, getting around Miami-Dade area can be difficult and challenging with traffic. And so by making sure we have a safe place for their baby to receive NICU level care, it's more convenient. They can spend more time with the baby instead of on the roads, so that when that baby is ready to go home, they know that baby and the baby knows them, and they can really begin that time together as a family.
We had the privilege, you shared us kind of a walkthrough through some of the rooms, and the rooms are really spacious for the entire family.
Correct.
It's important for the mom, the dad, and the abuelas and the whole family to be on board.
Exactly.
Now, I wanted to talk a little bit about emergencies.
Yeah.
Sometimes with traffic, people in emergency, the decision of which hospital to go to is kind of a quick decision that needs to be made, and then the next decision is to go there.
Yep.
So sometimes, depending where you are and with traffic, this hospital could be equidistant to a variety of different hospitals.
Sure.
Tell us why folks should come. When they've got an emergency and they're in the area, come here to Hialeah Hospital.
Well, here's what I would say is, number one, if you have an emergency, go to the nearest ER. I don't care if it's a Tenet, Hialeah, Palmetto, or any other hospital that's serving our community. Go to the nearest ER. Life and preservation of limb is paramount. For some of the lower acuity type of emergencies, when you have a little bit of time and you're asking yourself, what is the hospital where I know that I've received or I've heard people receive really kind care and timely care? They can get into the hospital, they feel safe, they get treated, and they can go home as soon as possible. Or if they need a little bit longer time, where can they be spending that time where they're comfortable? That's a very important question that you have to ask. So number one, for a real emergency, go to the nearest ER.
Right.
And if you are aware of trains and those types of things that might complicate that, I would expect, just like I would, make the decision that's best for you and your family, regardless of the hospital. Every ER is accredited. Every ER is licensed, held to the same standards. And so we're very proud to share that. So that's number one. But number two, then go to the place for emergency care that's a little bit less severe. Here to Hialeah, because we know you, we care for you, and we want to see you in our hospital and take good care of you.
We just talked about the emergency services. I saw on your website you have the ability where you could check in online before you come. So again, if it's not life or death, and like I said, it's a true emergency, where get to the nearest one. But your website has the ability to pre-check in online. I've never seen that before. Can you tell us a little bit more about that?
It's a product in Quicker that's also at all of our other tenant facilities. It allows you to basically make an appointment for your ER visit. It kind of lets us know you're coming, who you are. It kind of begins a registration process so that we're all anticipating that you're coming in, and we can optimize the care. For those patients that have a choice, it can be a real advantage, knowing that you're not going to be sitting in the ER for an extended amount of time. However, I will tell you, even without the Quicker, our ability to get patients, they walk into the door and they see a physician frequently within less than 5 minutes. 3 is the average, and very quickly get into a bed. So even without the use of that technology, I can tell you that we've been working extremely hard here at Hialeah Hospital to make sure we minimize the time that you stay out into the waiting room. If some people have had long waiting rooms, oftentimes that depends on how sick the people are in the ER,
right.
And we have to do a triage process like many of the other hospitals end up doing. So even with the Quicker product, that is also all then determined. You can have an appointment at the same time if an ambulance comes in and our medical staff need to focus on that life
Right.
or limb situation, life or death situation, they'll put the focus. But I find that everybody understands, because we communicate.
Right.
Here's what's happening. Here's why your wait is being delayed a little bit longer than we would like it to be.
And that's huge, that communication side, because just being here and having a variety of experiences at different hospitals, when you're in the dark,
Yeah.
it's the most frustrating. And you're waiting. It's the most frustrating thing. That's definitely happened to us before, not here, but elsewhere. We won't say where, but it's so frustrating as a patient when that happens to you. You want it, and you ask that one person that you may kind of know, and there's no response. Oh, we're checking, and then it's just vague, and you don't have any idea what's going on. That's huge. Now, you also showed us earlier the facility where someone comes in, where they kind of get diagnosed and evaluated, but if they don't necessarily need to stay here for a long time, where they have a kind of a nice area for them to where it's kind of private, and they're evaluated as they wait results from testing. Can you tell us a little bit more about it?
So about 3 months ago, we opened an observation unit. It's an observation status. It's kind of in between an ER and an inpatient basis. It's actually an outpatient setting of care. And it is a place where if the physicians have some questions that they want to get resolved to determine what might be the proper diagnosis, we can move patients into this area. Care is very quickly provided, test results and so forth. We have hospitalists that are going through reevaluating the patient, not just once a day, but several times during the day, every 3 to 6 hours, to do an assessment, look at the results, and then meet with the patient and say, here's what's going on, and what we recommend. Do we recommend admission, or do we recommend follow-up with your physician at the primary care or back at home? So it's really important because everybody has had the experience of having some test runs, sitting in the ER, watching all the activity, not entirely sure what's happening, and it doesn't feel really private. Here it's private room, access to a shower and a bathroom, so you can make sure that you continue to feel good, and you get time to evaluate what is the best thing for you and your health.
That's huge. Someone is thinking about, well, I got this thing, and it's more than urgent care, and I think, and you stressed that you don't want folks who just need something for urgent care to flood your ER. Urgent care, go to urgent care. But when they do have an ER situation that, let's say, it's not the emergency, true, your life and limb, you got to go to the nearest place. But when you've got that choice, the fact that you have private rooms, this evaluation area, I think is a huge difference maker for folks who want to say, hey, I really didn't know that Hialeah Hospital had that.
Yeah. We also use the unit, especially for patients that are seeing in their doctor's office, and the physician says, I'm really concerned about some of the things I'm seeing. They can now directly admit to that unit instead of sending patients to our ER. So they can very quickly tell the patient and call the hospital, and we can have a bed available for them. They just check in at registration and are taken directly up to the observation unit. What it does is prevent the physician from incurring the expense of an ER that they don't need, because the physician has already done the diagnosis, has already talked to the admitting physician, and is able to participate in the care. And so that's a new program that we're in the process of rolling out. We started last week.
Wow.
And we're reaching out to the urgent care, we're reaching out to the primary care, and also to the managed care clinics like Doctors Medical Center, Leon, and the rest, just to make them aware that we have this service. And again, it's about taking care of the patients, because why make somebody sit in the ER when they can just be resting comfortably in this observation unit, getting the final decision made about what they need.
That's excellent.
To take care of themselves.
That's I think something people don't know necessarily in the community. That's a huge thing.
That's correct. That's why I'm glad you're taking this time, because I think that, as we said before, is that through your blog, I came across it, read the article, and we believe here that beyond the billboards, beyond all the other very visible forms of marketing, what is best in our community is very grassroots. It's about neighbors talking to neighbors, sharing their experiences, and that becomes much more influential and compelling versus something that might be produced way out of market, and it doesn't quite have that local relationship. So I appreciate you taking time helping tell our story.
No, we definitely appreciate you having us and inviting us in. It's been really an eye-opening experience in terms of what's going on here at Hialeah.
Great.
So, different hospitals tend to get reputations for different specialties, and like some are more for trauma, some are more for heart surgeries or cancer. Tell us a little bit about some of the things that Hialeah really specializes in, and some of the areas that you're feel like maybe the community doesn't really know some of our strengths here at Hialeah Hospital?
I don't think a lot of people in the community realize that one of the most common conditions that we take care of is cardiology, cardiovascular, the heart and the vascular system. Because most of the need is medical cardiology, it's the heart failures, it's the arrhythmias, things that can be done in a community hospital setting. That's one of the largest areas that we provide care for this community is cardiovascular. And so we're going to be continuing to develop and grow that particular area. We're not going to be moving into interventions, open heart surgeries, because I think most people don't need that. What they need is good, capable medical management, and with our cardiologists in our community, I think they receive that. And again, like our other service lines, we're partnered with programs like Palmetto and North Shore that do have open heart and interventional programs that we partner with. Obviously, we're very well known for the labor and delivery, the babies that we provide, and that's going to be a place that we continue to take a lot of joy in providing to the community. But we also take care of and work with women's health. Women's health, as especially moving into the senior years, have very special needs, and we have developed a program with private rooms and with our OBGYNs, the ability to provide care in a respectful, private way,
Right.
that enables them to feel safe and get the care they need in this community. So women's health is incredibly important. It would probably surprise people that we perform about 15 spinal surgeries a month.
Wow.
That's fusions and other types of spinal procedures with our neurosurgeons. And so that's an area that as we get older, we need to have some intervention in that area. And we're rebuilding our joint program, total knees and hips.
Okay.
And one of the things that we're challenged with right now is kind of building out our orthopedic surgeons. We're in the process of bringing a new young orthopedic surgeon, Venezuelan, but trained in the Northeast, and
Okay.
he's looking forward to coming and serving the Hialeah community.
Excellent.
And he's also bringing sports medicine. So as our population ages, they're still active.
Yeah.
They're still playing golf. They're still doing all these things and spending time with their family. And so a sports medicine type program along with our joint program is an essential part of us keeping our community healthy and active and thriving.
What are some of the things that people in the community maybe don't know about Hialeah Hospital that you'd like to share with them?
I think what I am very, very proud of at Hialeah Hospital is the feedback we get from the people that we serve. I think that there's a continued lingering perception of Hialeah Hospital as a hospital that may not be at the level of some of our facilities in Miami-Dade, whether it's profit or nonprofit hospitals. However, when you go into our scores, among tenant facilities, we're among the highest ranked, not just in Florida, but throughout the company. And this hasn't been true just in the last 6 months. It's been historically true for Hialeah Hospital of having some of the highest patient experience scores in the system. Very proud of that. We also have very, very high physician scores. We survey our physicians that serve this community, and they give us really high marks for being a hospital that they're comfortable practicing in, that they feel their patients are receiving safe care, and that they are willing and do promote the hospital. And these are physicians that work in Hialeah and they work in other hospitals. And many of them, sometimes they talk about the struggle of telling patients, look, if you come to Hialeah Hospital, I will be your surgeon. Okay, so the surgeons tell me that they many times really work to communicate with the patients that they're going to get exceptional care, that they're going to feel safe, and that they're going to receive excellent service. And so that's really important, because if the physicians believe in Hialeah Hospital and they feel safe practicing and bringing patients here, that is incredibly important.
You said that when you first said the survey and the high scores. My perception was from the actual patients, which you are alluding to, but you're also talking about the scores from the doctors who are coming here and using your facilities and doing their procedures here. The doctors themselves are giving Hialeah Hospital really high scores.
That's correct. And these are physicians that work at some of the other hospitals in the area that people would perceive as being one of the better institutions in the area. Yet the physicians, if they had their preference, if they were able to overcome some of the patient's reluctance, would prefer to be here at Hialeah
Wow.
Hospital because of the care that they receive. I think that's exceptional. I don't think most people know that.
No.
And the reality is, if you go to social media over the last several months, whether it's Google reviews and some of the Yelp, we do have a couple of stories where we're learning from, but we have some exceptional stories of patients receiving outstanding care. And they name names, and they talk about their physicians, and they talk about their nurses and the other people that took care of them. And the common themes that are there is how they made me feel. They made me feel part of the family, made me feel safe. I understood what was happening. I understood, and I could communicate effectively with them. And so those are things that I'm very, very proud of. I'm sure every CEO that you talk to is going to speak to some of those things.
Right.
But I think that we have unique challenges here at Hialeah Hospital. We're overcoming them, and we're meeting our commitment to the community, provide high quality, safe care.
But even the fact that the doctors are so in favor of coming here and providing the service here and giving the care to a community that obviously is a big community that needs these types of services that you provide. And as we talked about as we were walking through, this is a community that is heavily Medicaid, Medicare, that cannot always afford to have their own insurance, so they're using, let's say, government assistance in some cases. This is a service that you guys are providing to the whole community.
Correct.
And it's not only it's a vital, it's called the heart of the community here in Hialeah.
Yeah.
So what you guys do to not only service the community but provide that high level of care is a huge thing.
Right. And it is challenging, from the funding source. You see some of the other hospitals in very public articles and news articles themselves struggle with the Medicaid funding that they do receive for the care they provide and how it affects their sustainability. We have that same struggle and opportunity. I think we run very efficiently. We try to spend money wisely and in the right areas to provide that care. And we do need the support of the community. Not shy to ask for it.
Sure.
We've talked about this. For somebody that's a Hialeah baby. We know you have choices to go. We know that you have the ability to choose which hospital you go to. All things being equal, we're asking the community to support Hialeah Hospital, to choose us, because the excellent care, the outstanding legacy that we've had in your family and other families like your own in serving this community. And I think that's valuable. One of the things that we've been playing around with and working on is a Hialeah Hospital family reunion.
Wow.
I want to put food trucks and bands out in the parking lot and
Oh,
invite
wow.
everybody that's been born in Hialeah to come back for a big, huge family picnic.
Right.
Just to remind the community again, Hialeah Hospital has been there for you in essential places, in essential times in your life.
Right.
And we continue to be here. We're still here. We're providing excellent care. We're promoting access to care.
Right.
And we just ask for your continued support.
Well, that's quite frankly a fantastic idea to get everyone who's been part of this Hialeah Hospital family to come on back for a reunion event. That'd be amazing.
I've done it in other settings in other markets, and I'll never forget one of my last hospitals of having a long-term OB, much like we have here,
Right.
Standing in the middle of the food line and meeting and greeting the adult babies that he was there at their birth. And I can't wait to see our OB physicians that have been in this community, serving this community for so long,
Right.
standing in the midst and having people walk up saying, "I remember you from 30 years ago. You helped give birth to my first son, and here's my son, he's 30 years old."
Wow.
Wouldn't that be just amazing?
Yeah, that would be. That is just a fantastic idea. And I think you need some overflow parking, but it would be a great way to get folks back here to Hialeah Hospital.
Yeah, I'm very proud of that legacy.
Now, in talking about that, one of the advantages, and you had mentioned this as we're walking through the hospital, is that you have folks here who have been working here, that they're tenured, that they've been working here for so many years. They know all ways to give the cheer. I mean, they're more experienced than you'll find in many other places. You want to talk a little bit about that?
I think that the more established hospitals in this community, I'd say this is true for if you create a great working environment where highly qualified nurses and technicians begin to feel this is a place I want to practice, they'll tend to be in that place for their entire career. And it's common that you'll have somebody, a nurse that was there at the birth of a child and is there at the birth of that child's child. And there's that sense of memory. As we all know, as people are working in the same organization, they develop an understanding and a depth through their ability to handle every situation that comes along. So we have a very long tenured staff here. It's both a challenge, but it's also an opportunity for us. And I think it promotes what I've been talking about, taking care of the patient, quality, safety, and service. These experienced nurses are incredible, and they provide that exceptional care and that human touch that we're all looking for.
What are you proudest about Hialeah Hospital?
Well, I'm proudest of my people. The people. When I came here 6 months ago, one of the first things they told me is they're a family. And they welcomed me like family. They've welcomed other people that have joined the management team as family, and really have taught us the importance of our community, the community that we serve, the Latin community in particular. They're very patient and tolerant with my Spanish, which is non-existent. But they're graceful, they're kind, they're passionate. And I think that's what makes me proud. I've never worked in a place that's this unique.
Wow.
And this so closely identified with the community that it serves. It's exciting, and it's a big challenge. The challenge is how to serve that community in a way that's relevant and meaningful. At the same time, how do we continue to reach out into new communities as people come into the Miami-Dade area and provide a safe place for them to have care. So ultimately, Hialeah Hospital is not the building. You've heard this in a lot of different settings, but I think it's also true here. Hialeah is the people. The people that work here, the people that come here as patients, the physicians that serve us. And that's what I'm most proud about, is the passion and the love of the people that work here, because they truly do love this community. They choose to work here. Many people live outside this community now, up in Pembroke and other Doral and other places, but they choose to come back to Hialeah Hospital because of their love for this community.
Are there any misconceptions about Hialeah Hospital you'd like to address?
Yeah, I think the biggest misconception is that it's not safe. People just sit there and say Hialeah Hospital. I think Hialeah Hospital is a safe hospital. Let me give you an example. Is that from a surgical site infections, we have had none in almost 2 years. That means a patient that had any kind of a surgery here has not experienced a surgical site infection. Our patient safety scores in the last 2 years has been at nationally ranked, national levels of numbers. When I talk to patients or I talk to the community, there's a little bit of Hialeah Hospital. It's that hospital that's been around forever.
Right.
It used to be something, and now it's kind of not. I think it's unfair, and I think we're going to continue to demonstrate that we're a safe hospital. You receive exceptional care, and that you'll go home and you'll be healthier, and you're going to be happier, and you're going to look back on your experiences, one you didn't want to have. Nobody wants to come to the hospital, but you're glad you had here at Hialeah Hospital.
We're blessed to have so many different options, down here, because we do have a lot. It's not like, in some places there's only one place to go, so you do have a lot of options. But then you have a lot of quality options, and Hialeah is one of them.
Yeah, I believe that's true. I think that, one of the challenges, something we've talked about, is that there's some people like us who have options. Whether it's because of our ability to transport ourselves, we've got the money to be able to have a car and go to a different hospital outside of our community. But for a vast majority of folks that live around Hialeah Hospital, they live in assisted living homes. They live in, they're homebound. They're older. They don't have as many choices that we're used to having.
That's a great point.
Does that make sense?
Yeah.
And so, our number one mission is to be a safe hospital within this community. And I think our goal is to be a world-class hospital, so even people that have the means to go outside of the community to get care and to exercise that choice. Instead, we'll say, why would I go so far away when I can stay in my neighborhood? I can support my community. I can support Hialeah Hospital that has supported me all this time, because I know I'll get that same high quality of care with physicians that are in my community and that contribute to this community.
In other words, you don't have to go far away to get quality service. Quality service is right here at
That's
home.
correct.
Now, what are some of the new changes going on here at the hospital?
I think some of the new changes is we are in a process where we're bringing new physicians to the community. I think that's very, very exciting, because new physicians bring in new insights and new training and new skill sets that serve our community. So that's something, as I talked about with the orthopedic surgeon, that we're in the process of bringing in some new OBs that are supporting and freshening some of our experienced medical staff. I think that's something new. That's an investment we make.
Right.
We have resources that we can provide and help them become established appropriately, so that they can really set their feet, put roots in, serve this community. When we bring a new physician, when we help a new physician come into the community, oftentimes they come in for life, and they become part of this community. So it's incredibly important. We're in that time of our life where we're looking, as a hospital, how can we bring in more physicians? We're looking outside of the area, for example, working with FIU, with medical students, with internationally trained students, such as a group of about 20 Chinese physicians that came specifically to Hialeah because of what they had heard about Hialeah Hospital. And the work that we do here is to get experience. And I asked many of them, I said, how many of you want to come back and work in Hialeah Hospital? And they all looked at each other and, some of them raised their hand, because they see the opportunity, they see the need, and they see the community that they would serve. So that's one thing I'm really excited about. We're also in the process of going through renovations. I think, as we both acknowledge, the newest part of the hospital was built in 1972. It's one thing to have an old hospital that it's clean, but it's also spending some additional resources on things that we do in our own house.
Right.
You don't have the same paint scheme from the 1970s in your house. You need to update that, and those are things that we're in the process. So all throughout the campus, you'll see signs of renovation. When you walk into our main lobby, there's a large plastic wrapped area around our reception area. We're changing how we are setting up our front lobby. So instead of being where you walk up to a desk and it feels very institutional, we're moving to a concierge model, almost like an Apple store, if you will, where somebody will walk up to you and say, we're glad you're here, let's get you signed in, and let's make sure we get you to the right place. Those things are just more and more human touches in our patient experience that we're incorporating into it. So I think what's really most exciting about Hialeah Hospital, again, it goes to the thing I'm most proud about, and the thing we're continuing to put money and resources into, and that's people. Training our people to take care of people that show up, make them feel comfortable, make them feel safe.
As we walked around, you're showing me some of the rooms. Some of them are and I know you're talking about you're doing renovations, but some of them already have been renovated and looking great.
Yes, thank you.
So you've done already some of the improvements are already shown up.
Well, I think one of the things that surprised you, and I think would surprise most folks, is as an older hospital, they anticipate I'm most likely going to be sharing my room. But depending on what you're coming in for, we have private rooms. For example, labor and delivery, both pre-delivery and post-delivery. You'll have a private room so you can spend time bonding with your baby and with the family. For many of our surgical procedures, orthopedics, spine, and we do bariatric surgeries here as well for weight loss.
Right.
You'll have a private room that allows you to recover in a sense of privacy, and it also helps promote the safety of the recovery. For the women's health, women that are experiencing procedures related to their needs will also receive it in an area that's very private, unexpectedly nice and comfortable, and as many family want to stay with them and support them through that time of their life is important.
Yeah.
So that's one area that beyond the people that we've talked about that I'm proud of, I think what's unexpected is the facilities that we do have. Once you get kind of past the parking lot and the exterior, you find that we have been, over the years, been updating and providing a private patient experience.
Well, I will say some of the labor rooms that you showed us were far bigger than, again, I don't want to call it out, but some of the quote-unquote newer hospitals that I've seen and I've been in some of the cramped rooms. You really have a spacious rooms here.
Yeah,
for some of the rooms that we walked through today.
because I think it really reflects, again, an understanding of what's important to our community. What's important to our community is when you have a baby that's born in this hospital, everybody in the family wants to come.
Absolutely. Especially here.
There's not just going to be a dad or a partner that's going to be sitting there
Yeah.
with the new mom and gathering. There's going to be the grandparents, the aunts, the uncles, the cousins.
Abuela, tía, abuelo, tío.
Exactly. And we want to make sure that there's enough space for them to come in and have that warm, because none of us are born into a vacuum. All of us are born into a family.
Yeah.
And that has to start from the beginning, so that child grows up feeling connected, feeling part of a family, and then part of a community. And as we talked about, that's a fantastic foundation for a healthy life that begins here at Hialeah Hospital, is that one connection to all that family coming in.
Looking further down the road, hey, what else is ahead for the future of Hialeah Hospital?
Yeah, I think with the challenge of how healthcare is being changed, and there's been a repeal of the certificate of need that's going to allow many other people to decide if they're going to invest in building hospitals that are in Hialeah or adjacent to Hialeah. So we're going to be challenged with some competition. I think in some areas that's good. It will continue to poke us and provoke us to ensure that we're taking care of our patients, making the right investments, making sure that we're more effective at telling our story so that people know that we're still here and we can stand shoulder to shoulder with anybody in the community. I think that's going to be one of the biggest challenges. Along with that is how, especially the government, is moving healthcare away from hospitals into outpatient settings. And so I think what's going to happen is that Hialeah Hospital is going to become in some ways smaller. I don't mean the building's going to get smaller, but fewer people are going to have long length of stays in the hospital. But people that do come to Hialeah Hospital are going to be much sicker. And they're going to need higher services, more complexity. So I believe that the hospital of the future, not just at Hialeah, is we're going to see more and more of an ICU and intensive care. That service is going to grow because it will reflect the need of the community. So right now we're working with our sister facility, for example, at Palmetto, to ensure that our acute critical care services are neatly fitting within what they can provide so that patients can come to Hialeah with stroke and other type of symptoms, receive excellent world-class care connected to a larger network. And so I think that's what you're going to see. You're going to see fewer people in the hospital. They're going to have more needs. We're going to be challenged to meet those needs with fewer dollars. And that's going to be a challenge. But I think that something when I stand on top of this hospital, and I look at the neighborhood around us, I see a Hialeah that's being invigorated. Yeah. You see some new housing that's starting to develop and backfill into the neighborhood around us. I look at the blocks around us, and I just imagine what if with our partners, with Leon and some of the Doctors Medical Center and some of the other partners we have within this community, we transform this neighborhood around us into this healthcare destination district where people could come into and get all this outpatient care. So we're looking at all these different options because all that great quality we talked about within the hospital, we believe we can transport into the outpatient setting and provide many different places within this area that patients can receive care. It's cost effective, high quality, and safe. And if they need higher acute services, Hialeah Hospital will be there.
Well, it's an incredible vision to have what seems like more of a medical campus.
Medical campus.
Here in Hialeah. It's actually a wonderful dream to make that into a reality in the future would be an incredible thing here.
It provides it would provide access to care for our community in a setting of care that is cost effective. But imagine the jobs. Imagine the economic resource that we would be providing to the city of Hialeah.
Right in the heart of this community.
Right here. Great paying jobs for people that, like we talked about, I want to be able to say to a Hialeah high school graduate or a Springs graduate, saying if you want a great paying job within this community, taking care of your community, we can we can point you in that direction
Okay.
of the training and the experience that you need so that you can work here at Hialeah Hospital, spend your life here taking care of your family.
That's excellent.
I think it's an outstanding, it'll help the city grow. I think the city of Hialeah is fantastic. I think there's so much opportunity as one of the largest cities within Florida to continue to grow and develop and be a great place to live.
And we appreciate you extending that offer to the folks at Miami Springs Senior High and
I just
the kids.
need to sit down with them and sign the contract.
There you go. A lot of things that people are not familiar here with Hialeah Hospital. So we really appreciate that. Any other topics that you'd like to address that you feel we haven't touched on and you'd like to share with the community?
No, I just think that this has just been a great opportunity. I mean, and Nestor, you've been a very receptive.
I appreciate you inviting us here.
For me, and hopefully this has been as illuminating for your audience as.
It definitely has been for me. I've learned a whole lot here.
And I just think, as we all know, the healthcare world is changing.
Right.
There's going to be and more choices that are available to people that can make a choice. And I just think that, as we talked about, is we need to be better at telling our story, but we're also looking to the community to support Hialeah Hospital, not from an income standpoint, but because of the service that we provide, the needs that we meet in this community, that you see us as a partner, and not just the healthcare needs of the community, but also as a vital resource within the city of Hialeah and the surrounding region. And one that has earned and deserves and will continue to earn the respect of the community and be seen as a valuable partner. That's what I desire and am working towards. So just appreciate this opportunity. This has been a great experience for me.
Michael, we really appreciate you making this yourself available, and I can tell you from myself and the entire community, we appreciate you opening the doors to Hialeah Hospital and let us learn more about what Hialeah Hospital. It's something that has, I'll say, even for the folks in Miami Springs, especially the folks who've been there for a long time, Hialeah Hospital definitely has a history with the folks in Miami Springs, whether they were born there or had different procedures with Hialeah Hospital. And you've been a huge part for so many lives and it's still the heart of the city of Hialeah. So we really appreciate it. Thank you so much. I really appreciate you taking the time and doing this with us.
Yeah, thank you, Nestor. I just want to say one thing to you. Welcome home.
Thank you. Appreciate it.